Okay, so Medicaid may in fact end up looking very different if the president's spending bill passes, and now Republicans seek to add a new work requirement that could impact millions. It's part of an effort to rein in the nation's safety net program with up to $1 trillion in cuts. While the bill would cap and reduce taxes states impose on hospitals, it would also require most adults to work, volunteer, or study 80 hours a month to qualify for enrollment. So what does that mean for the millions of people who rely on the program? Well, we're joined now by Julie Rovner, Chief Washington Correspondent for Kaiser Family Foundation Health News. Julie, good morning.
Good morning.
So I want to talk about this work requirement. The idea of work requirements is not new. States have done it for a while. Can you talk about what's distinct done in this bill?
Yeah, most people on Medicaid already meet these requirements. They either work or they go to school or they care for someone at home. The problem isn't the work requirement itself. The problem is the paperwork that's involved with the work requirement. What we found in states that have tried to do this is that people have difficulty reporting these activities or proving that they've done these things. They have trouble uploading documents. Someone described it as like having to file your income taxes every month. That's how eligible people end up losing coverage. And indeed, the Congressional Budget Office says that perhaps as many as 12 million people could lose coverage if this bill becomes law.
I also want to talk about the effect on hospitals, because I don't always understand hospital math, right? How do changes to Medicaid affect everybody else for that industry?
Well, people get sick regardless of whether they have insurance. So if they have Medicaid and they get sick and they come to the hospitals get paid. They don't necessarily get paid as much as they would if the people had private insurance or Medicare, but they do get paid something. If these people lose their insurance, they're still going to come to the hospital. The hospital's still going to treat them, but now they won't get paid. This is a huge problem for hospitals that have large populations of Medicaid patients. That includes inner city urban hospitals, but also rural hospitals where a lot of people are on Medicaid. So if these people become uninsured, the hospitals could well go under.
And finally, the math. I don't know if it's semantics about whether these are cuts or changes or increases. Help me understand the talking points.
Yeah, this goes back years and years and years to when Congress used to try to cut Medicare, and there were arguments that we're not really cutting it. It's true that Medicaid spending will continue to grow, but if it doesn't keep up with the cost of health care or the numbers who are eligible, then there will be less money for these hospitals, for these people. So yes, in the aggregate, Medicaid spending will go up, but that doesn't mean that people won't lose their coverage, and hospitals be hurt by the fact that they're going to have to treat patients who don't have any insurance.
Julie Rovner is Chief Washington Correspondent for Kaiser Family Foundation Health News. Thank you, Julie.
Thank you.